Thank you. Yes, I'm going to talk to you about the catchy title Chemist, which actually stands for Community Pharmacy Mood Intervention Study. Starting with the Chemist study is why did we want to do this study? Well, we know that depression is a really common and disabling condition for a lot of people, and particularly for a lot of people with long-term health problems. And the trouble for people with long-term health problems and depression is that it worsens outcomes across the board for people. So it's very unpleasant for people, but it also worsens somebody's health outcomes across the board. There's a sort of depression called subthreshold depression, which means you're not really depressed, but you've got 2 to 4 symptoms of depression. And that in itself actually worsens your health outcomes and also is very distressing for people. And it is also the largest risk factor for progression to major depression. So subthreshold depression is a key challenge. And moving to community pharmacies. Well, community pharmacies are really out there in people's communities. So a colleague of ours on the study did some work which said that 90% of people are within 20 minutes walk of a community pharmacy. And they have a very high health promotion role, which is being pushed more and more. And what we know about subthreshold depression is actually people don't tend to get offered any intervention for it. So they don't fulfill the criteria to go into talking treatment services most of the time. And the drugs don't work for that, so they don't tend to get prescribed antidepressants. So people are left with nothing. And we ran a study recently which Simon led called the Casper study, and what we found in that study in older adults was there was a significant reduction. This was a study for older adults with subthreshold depression, a significant reduction in progression to major depression in that study. So our heads got together with some of our colleagues in pharmacy, in the academic pharmacy world, and it really made some sense to say, could we translate this sort of health promotion approach into a community pharmacy setting which is really accessible to an awful lot of people that aren't getting much? And this links really into the 5-year plan in terms of working across boundaries in new areas and trying to build health promotion. But this research had never been done. So we approached the National Institute of Health Research and we got funded through the Public Health Research Programme to explore this. But it's never been done, so they were only interested really, or they were very interested, but they didn't feel it was of a level that they could fund a full study. So we've been funded for 2 phases. The first phase is a feasibility phase, where we aim to recruit about 20 people and really explore how can you recruit people to this sort of study through community pharmacy settings, because it really hadn't or hasn't been done for this condition. And also we didn't know how we would translate the intervention. So we worked very closely with service user partners with lived experience and a lot of other stakeholders to refine our materials, but we needed to test those out and get feedback from people going through the procedure and the healthy living practitioners in the community pharmacies who will be delivering this. So we needed to see whether or not we could deliver this intervention. And of course, we needed to see if we could bring people in and deliver our study procedures. So could we get them to complete the measures that we would need to tell us whether or not this worked? And we're doing this through conducting both qualitative interviews, so asking people, and focus groups, asking stakeholders about how the procedures went and looking at the rate of collection. And when we've done that, we're going to then run what we call a pilot trial, which is a trial in miniature, where we test out our intervention versus usual care. Now, what that won't tell us really is definitively whether this intervention can achieve our goals. We'd need a much bigger study, but it will help us work out whether or not we can deliver this on a larger scale and how many people we would need to approach in order to deliver that, and can we keep people in the intervention and follow up. So, and through there we will also have an opportunity to kind of iteratively develop our intervention a bit further, and if it proves successful, we would then go back to our funder to to look to fund a large-scale definitive study to see if this works. So really what we're aiming to do in this study, and I think it's quite an exciting study because it's new, it's breaking new ground, it's really looking at health promotion for a group who don't really get much, being delivered by an accessible community resource in a new way. So we're trying to adapt our self-help materials and our training to see if we can deliver it, to develop and refine recruitment and study procedures. We need to determine whether the full trial is possible through the pilot trial, and we need to explore whether or not there's a potential for good value for money in terms of health services in the UK. And what we're learning is recruitment's a challenge. Recruitment's really difficult in this setting, and actually it's very different to our previous studies where we've recruited in primary care. But we're getting there. We're starting to know how to do this. We do seem to be able to train the community pharmacy staff to produce or to provide this health promotion role using our materials in order to deliver this depression prevention, this depression health promotion self-help materials. And the early indications, and they are early indications from people that have gone through the intervention, is that they seem to find this intervention, you know, our early indications are these interventions from the feasibility study are acceptable. People are thinking that this is usable within this setting. So I think there's a lot of promise in this study, but it's really early days at the moment, and we're looking forward to learning more as time goes on. So thank you very much for listening.